As I think about growing up in South Los Angeles, and I tour the community today, there doesn't seem to be much difference other than the demographics. But there was a strong sense of education in our communities. So there was never a question between, I have a twin brother, that we would not go to college. He's a PhD in physical chemistry, and I got a doctorate in health services administration. I was working as a social worker out of college, and then all of a sudden there was a slight disturbance in South Central Los Angeles. There was rioting going on. And someone asked me would I want to go and move into a program with the big county general hospital. And once I got there, boom, they decided to open a hospital in South Central. And the administrator said, well, we need a personnel director. I said, okay, I will take that. Well, that's when I decided that maybe my career direction should be in health. And then from there, I went to Howard University to start a new school for training. And then, as I say, 10 years later, I come back to Drew to set up a school at Drew University that was comparable to what we had put together at Howard. Well, I don't remember the exact year that I got involved with the coalition, but what I do remember is that Mark Ridley-Thomas came to the office and he says, Harry, I got a project I'd like for you to work on. And that's not unusual for him because we had been working on a number of projects in the community. I was the dean of the College of Allied Health at that time. And I said, well, let me think about this. I have to talk to the president. And he said, well, that's okay. I've already talked to the president. And he said, yeah, you can do it. So I said, okay. But I didn't know it wasn't going to be a part-time assignment. It became a career assignment because, as I understand, I've been involved with the coalition for 25 years. I'm basically a radical humanist. That's basically my philosophy. In other words, you want to change the system. You don't want to stay with the status quo. And at that time, I had done some reading on what they call mediating systems. In order for government to change, you need to have anchor organizations within the community that serve as a mediating system between that community and the government and policy. And now that was a Republican idea, and as you knew, that's what they were doing all over the South and around. Well, the Republicans can have good ideas, and so I said the community coalition is a mediating system. And that's when I kept telling Karen, you have to have a permanent residence here. And that's when they moved here, renting this property from the city and then buying it, under Marquise and then renovating it. But you have a permanent structure that gives a projection of permanency. When people see you own something, that you're there, you're going to be there, and that you're doing good work.
A symbol of hope, of the possibility of what can happen when you focus, you organize, and you keep your eyes on the prize.
One of the things that I've learned is that the struggle is intergenerational. If you look at Community Coalition, think about the intergenerational connection between the leadership. Each of them is well-grounded in what is the activist activities that are necessary to keep moving. I am deeply honored to be a recipient of the Charlotta Bass Award, so I thank you for considering me for this award.